This lesson today is going to deal with a prioritization strategy that I like to teach the people that I tutor, and that is to stay in the now, not the past or the future, because you are only one person. You are only one nurse. You have 4 patients. Who would you see first? Stay in the now. So let's read the question. The nurse has received the following information about assigned clients. The nurse should first assess the client. This is what I'm talking about. You are but one person. You have 4 assigned clients. Who would you see first? Now, when we read each of these questions, let's put a N for now, a P for past, or a F for future next to each one of our questions here. So, with prostate cancer and metastasis, who has developed numbing and tingling in the legs? Is this happening now, past, or future? They have the prostate cancer now, and who has developed. Has is a adjective that is happening now, right? So let's put a N next to this answer. Okay, very good. Let's continue. B, who had a knee replacement 2 days ago and is reporting pain in the affected knee. Now, if I've been tutoring you, I've been telling you that pain is a psychosocial issue that should always be picked last unless we cause the pain. You know, maybe we put an IV in wrong, maybe we did something in surgery. If we cause the pain, you always pick the pain answer. But for the majority of the NCLEX, pain is a psychosocial issue that should be picked last. That was mentioned in the video, the steps of prioritization. But here we're talking about the techniques, the now, past, and future technique. So let's focus on the now, past, or future. So who had a total knee replacement 2 days ago? Okay, this is past, right? So let's put a P for past. You always want to focus on what brought them to the facility, what brought them in for surgery, what brought them into urgent care. That's what we are focusing on. So, who had a total knee replacement 2 days ago? Past. Okay, C, with COPD, who is using pursed lip breathing after taking a shower. After taking a shower. So, this is happening now. With COPD, who is using pursed lip breathing after taking a shower? This is happening now. So let's put an N. And our final answer, D, who had an appendectomy 2 days ago and has not had a bowel movement since surgery. Who had an appendectomy 2 days ago. That is the past. So put a P for past. Now, by using this technique, we can see that we can eliminate two answers. And what two answers are they? It is B, because that's happening in the past, and D, because that's happening in the past. So when we eliminate B and D, we are left with A and C. Now, let's look at A. With prostate cancer and metastasis, who has developed? So they are developing the numbing and the tingling right now, right? Who has developed? If we look at the C, that's also happening now. COPD is chronic, right? Who is using pursed lip breathing after taking a shower. So of the two, the numbness and tingling is the numbing and tingling is happening now because of the ing. Now, right? COPD is a chronic condition that people live with. Remember what I told you in the other video, in my other prioritization video, to pick acute over chronic, right? So COPD is chronic. So, therefore, we don't want to pick it. With prostate cancer and metastasis, who has developed numbing and tingling in the legs? Numbing and tingling, ing, happening now. This is acute, right? So there we go. Remember to pick acute over chronic. Acute is always happening now, right? Chronic, the condition may or may not be happening now. In this case, it was. But we know that COPD is chronic. So, therefore, ladies and gentlemen, what is your answer? Very good. Your answer is A. And that is how you do the now, past, or present technique. All right, guys. Thank you for joining this session, and I'll see you in the next video.